Yes, perfect. Thank you so much. Welcome.
Thank you, Shweta. Hi, this is Dr. Rijaphin, Consultant Obstetrics Gynecology, cloudnine OMR Chennai. So first of all, congratulations.
என்ன ஜாமீன்ல எடுக்கிறதுக்காக அந்த ஜெயஸ் கிட்ட ஏத்தேல பேசினா அவகிட்ட சண்டையில போட்ட அவளா இவ்வளவு காரியத்தை பண்ணிருக்கா என்னால நம்பவே முடியலையே பாட்டி.
So today, we should discuss about the changes that a parent, that is a mother, to be will undergo in the third trimester. So as am I audible?
Dr. Arutya, can we have a volume? Can you adjust the volume, please? You're not clearly audible.
ஜான்சியா அது யாரு யார் மர்மோல ஜான்சி
Is it okay now?
Yes, Dr. Rijaphin. Yeah, thank you.
First of all, congratulations to all the parents to be. I'm very sure all of you here are super excited and very anxious regarding your pregnancy journey. So today, I'm going to discuss about the changes that each mother and her baby is undergoing in the third trimester. So the third trimester actually starts around 28 weeks and it ends at 40 weeks or till you deliver. So your baby is growing really fast. I'm very sure you're all interested to know what your baby can do at this point of time. So your baby can actually open its eyes, see, hear, smile, cry, and also suck its thumb. So apart from that, your baby's brain is growing super fast and your baby's muscle tone is also increasing. So at around 36 weeks, your baby actually goes to the lower uterine segment and it occupies the favorable position, that is the head down position. So what are the changes that you as mothers are undergoing at this point of time? I'm very sure all of you are having a very big baby bump, because of which you are having a lot of discomfort in your back, your thighs, your abdomen. So how do you prevent this back pain? So the only solution is to adopt an erect posture. So when you're sitting also, sit with a chair with a proper backrest and wear comfortable shoes without any heels. Wear loose cotton clothes. When you're lying down, please do lie in on either side, preferably the left, with a big pillow between your thighs. Apart from this, your back pain is still persistent. You can have hot baths, hot fomentation, and also analgesics like paracetamol after your doctor's consultation. So I'm very sure most of you are experiencing Braxton Hicks contractions. So don't worry, this is very, very normal in your pregnancy because your uterus is preparing for labor. So these contractions are not your true labor pains because they are very irregular, they do not follow any pattern, and they come and go frequently. They are also painless. So do you all have increased frequency of urination? Are you worried about that? So don't worry, that is also very common in the third trimester. It is because the baby is pressing on the bladder. So what you can do is, you can drink a lot of fluids, but avoid drinking fluids before going to bed to avoid using the restroom in the nights. And apart from this, you might also have stress urinary incontinence, which is also very normal because your bladder is not able to hold the urine. So you tend to pee very frequently and also on coughing, sneezing, or even laughing. So to avoid this, you can practice Kegels exercises. Now you can also have swelling as well as varicosities in the lower legs, which is also very normal. You just need to lift your leg and keep it little elevated and also have some stockings. To have bleeding in pregnancy is not normal. You need to consult your doctor as soon as possible. And you need to watch your baby's movements. How do you watch your baby's movements? After a meal, preferably you lie to one side, particularly the left-hand side, and you can count your baby's kicks or even swishes or even rolls. So count till you're able to perceive 10 movements. So you should have at least 10 movements in a 2-hour period. You can also have heartburn, constipation. To avoid this, have frequent small meals, avoid spicy and oily foods, have a lot of fruits and vegetables in your diet, and also have a lot of liquids and high roughage diet. So this will avoid constipation. It is okay if you're having shortness of breath, but shortness with chest discomfort, you need to consult your doctor. And some can experience a sticky yellow fluid which is expressed from your nipples, but don't be scared, just wipe it, don't squeeze it. And apart from this, you can also have a lot more problems which you can solve by having a proper exercise routine as well as a diet. So, how often you need to visit your doctor? After 28 weeks, you need to consult your doctor once in 2 weeks. After 36 weeks, you need to consult your doctor every week. So, with each visit, your doctor will check your blood pressure, your weight, and also your baby's well being and baby's heartbeat. If required, a growth scan will be done as per the needs of the patient. So these are the do's and don'ts in the third trimester of pregnancy. Now, what are the red flag signs that you need to be alert? Are you need to check on the baby's movements. If your baby's movements are less, or you're having any pain starting from the back, going to the lower abdomen, increasing in intensity and frequency, you need to immediately go to your hospital. Apart from that, any headache, sudden swelling, or any increased vomiting, dimness of vision, bleeding, or even watery discharge, don't panic, just put a clean diaper and go to your hospital. So have a safe delivery and also a happy motherhood. Bye.
Thank you.
Thank you so much, Dr. Rijaphin. We have one query here, Dr. Rijaphin.
Yeah.
It's regarding the pelvic pain.
Okay.
So my wife has left side pelvic pain. What can be done for this? Yeah.
Okay. So she has pelvic pain. Pelvic pain in the sense she has pain in the left side iliac fossa, or she has in the left thigh radiating down.
So it's not specific. It has left side pelvic pain.
Okay. See,
Thigh.
actually,
It's
thigh.
about the thigh. Yeah.
Yeah, okay. See, normally what happens as your pregnancy grows, there is a ligament called the uterosacral ligament. So that, and also the round ligament that keeps stretching. So these pain is actually very normal in pregnancy. And also the pelvic pain is normal because the ligaments actually become loose. Your baby and your pelvis is actually preparing for the labor. So it is very normal. Suppose you are having this pain frequently associated with any other symptoms like vomiting or anything, then you need to approach your doctor. So they will evaluate if there is any other problem like stones, if the pain is actually radiating to the back. So a detailed history has to be taken to see whether there is any other pathology associated. But otherwise, pelvic pain is normal in pregnancy because of the ligaments getting lax and your baby, the pelvis is actually preparing for the labor.
Sure. Thank you so much, Dr. Rijaphin. And for all of you moms and dads to be, we also have a community where our specialists can take your queries. So you can always visit the community and get your queries answered. For now, I think thank you very much, Dr. Rijaphin, for such a great prep talk for all the mamas and papas. I'm sure you have brought down the anxiety levels of everyone here. So thank you so much.
Thank you, Shweta.
Thank you.